Welcome to Insight for Healthier Life. Do you know that one simple vitamin could be a game changer in the fight against diabetes? A nutrient so powerful that it may help lower blood sugar, improve insulin sensitivity, and even protect against life-threatening complications? If you or a loved one is dealing with type 2 diabetes or prediabetes, this might be the missing piece in your health journey. The staggering cost of diabetes isn't just measured in dollars, it's measured in lives affected globally. But what if the solution isn't as complicated as we think? Science is uncovering the critical role of vitamin B9, also known as folate, in diabetes management, and the results are too powerful to ignore. But don't just take my word for it. I will be sharing groundbreaking clinical trials that reveal how folate could be the essential nutrient diabetics need daily to regain control of their health. Stay with me because what you are about to learn in the next few minutes might just change everything. But here is a surprise. Do you know that low folate levels in diabetics could lead to something as serious as insulin resistance? This hidden danger can cause blood sugar levels to spike, leaving many to wonder, is this the missing link we've been looking for? Let's look deep into the science of folate, its powerful mechanisms, and how this unassuming vitamin is helping diabetics everywhere manage blood sugar and reduce long-term risk. Vitamin B9, also known as folate, is much more than just a nutrient found in leafy greens. It's an essential vitamin that plays a pivotal role in reducing inflammation, supporting heart health, and even promoting healthy brain function. But when it comes to diabetes, the impact of folate goes beyond these general benefits. It holds a specific power, controlling oxidative stress and improving insulin sensitivity. Let's break it down a little bit. When you manage to keep oxidative stress in check, you help reduce cellular damage that can lead to insulin resistance, a key contributor to high blood sugar. Folate is a master antioxidant that helps stabilize oxidative stress by neutralizing harmful free radicals in the body. This makes it a vital ally in managing diabetes, as uncontrolled oxidative stress is a major factor in the progression of diabetes complications like neuropathy and cardiovascular disease. Now, what if one simple nutrient could help lower blood sugar, improve insulin sensitivity, and reduce the risk of life-threatening diabetic complications? Sounds too good to be true? Science says otherwise. Two groundbreaking clinical studies have put folate in the spotlight as a potential trailblazer in diabetes management, and the results are hard to ignore. Let's start with a major meta-analysis published in the American Journal of Clinical Nutrition by Lind and co-workers. This study analyzed data from 22,250 participants and found that folate supplementation significantly improved insulin sensitivity, reduced blood sugar levels, and lower oxidative stress markers, key drivers of diabetic complications like heart disease, kidney failure, and nerve damage. But that's not all. Another powerful study published in Diabetes Care by Yitsu and colleagues tracked 4,704 American adults over 30 years to examine how folate, vitamin B6, and vitamin B12 intake influenced diabetes risk. The striking discovery? Only folate intake was linked to a lower risk of developing diabetes. Participants who consumed more folate had better insulin sensitivity and lower oxidative stress, making it a critical nutrient in diabetes prevention. The science is clear. Folate is more than just another vitamin. It could be the missing link in diabetes management, And these studies prove why it deserves a place in your daily health routine. Here is a thought-provoking question. What makes this one vitamin so powerful that it can influence blood sugar, insulin sensitivity, and even protect against deadly complications? Let's start with one of its most crucial roles, homocysteine control. You may not have heard of homocysteine, but it's a compound in your blood that, when elevated, is a major red flag for heart disease, strokes, and other cardiovascular problems. And here is the catch. Diabetics are already at a higher risk for these complications. This is where folate steps in. Studies show that folate can lower homocysteine levels, reducing the risk of heart-related issues and helping to protect against one of the biggest threats diabetics face. Now to blood sugar control. Folate isn't just essential for overall health. It plays a direct role in blood sugar control. How? By reducing homocysteine, a compound that can make your body less responsive to insulin. When insulin sensitivity improves, your cells can absorb glucose more efficiently, leading to lower blood sugar levels. And here's why this matters. Poor blood sugar control over time leads to higher A1C levels, increasing the risk of severe complications. Just take a look at this breakdown. A healthy A1C goal for diabetics is around 6 to 7%. If your fasting blood sugar FBS is consistently between 126 to 154 mg per deciliter, you are in that target range. But if your fasting blood sugar is consistently above 240 mg per deciliter for over 3 months, your A1C will likely soar past 10%, which puts you in dangerous territory for long-term damage. This is why controlling blood sugar isn't just about diet. It's about giving your body the nutrients it needs to regulate insulin effectively. Next, let's talk about neuropathy. That burning, tingling sensation in your hands and feet. If you are living with diabetes, you know that nerve damage is one of the most frustrating and debilitating complications. But here is the exciting part. Research suggests that folate may play a crucial role in nerve regeneration. How? Well, folate is essential for DNA repair and cell growth, including the regeneration of myelin sheaths, the protective layer around nerve fibers. This sheath is critical for proper nerve function, and when it's damaged, it leads to the pain, numbness, and tingling that many diabetics experience. But that's not all. Folate also reduces oxidative stress and lowers free radical damage, two major culprits behind nerve deterioration. By supporting nerve repair at a cellular level, folate could be a powerful ally in managing and even preventing diabetic neuropathy. If nerve pain has been a constant struggle, it's time to explore how this essential nutrient could help restore and protect your nerves. Let's not forget about inflammation, which is a constant battle for diabetics. It's not just a side effect. It actually worsens insulin resistance and accelerates damage to your organs. But what if there was a natural way to fight back? Folate might be the key. Research shows that folate actively reduces inflammation, helping to protect your body from harmful effects of long-term uncontrolled blood sugar. By keeping inflammation in check, folate doesn't just support better blood sugar control, it also slows the progression of diabetic complications, making it a powerful yet often overlooked tool in diabetes management. Another surprising benefit is in wound healing. Why do wounds take so long to heal in diabetics? It's not just an inconvenience, it's a serious risk that can lead to infections,
ulcers, and even amputations. But what if there was a way to speed up the healing process? Here's where folate steps in. We now know that folate plays a key role in cell growth, tissue repair, and blood vessel formation, all of which are essential for wound healing. High blood sugar and poor circulation slow down this process, making even minor cuts and sores dangerous for diabetics. If slow healing wounds have been a concern, this overlooked nutrient might be the missing piece your body needs to recover faster and stronger. And while we are talking about essential nutrients for diabetes, vitamin D is another powerful ally worth considering. If you haven't seen my video on the incredible role of vitamin D in diabetes management, check out the link on the screen. But back to folate. Its impact on diabetic health is undeniable, and understanding its role could change everything for those looking to take control of their condition. Clinical effects of folate deficiency in diabetics. What happens if you are folate deficient? Well, here is the problem. Many diabetics are deficient in folate, and this deficiency can trigger a cascade of issues. Lack of folate leads to insulin resistance, making it even harder for your body to keep blood sugar under control. Higher blood sugar means higher A1C levels and a greater risk for complications like neuropathy and retinopathy. Deficiency in folate also contributes to anemia, which can make you feel tired and weak, further complicating diabetes management. And for pregnant women, especially those with diabetes, low folate increases the risk of having a macrosomic baby, that is, a baby born too large, leading to higher delivery complications, childhood obesity, and diabetes in childhood. Moreover, folate deficiency has been linked to depression and cardiovascular disease, both of which are far more common in people with diabetes. The good news, this can all be prevented with adequate folate intake. So, where can you get your folate fix? Guess what? Getting folate is simple and it's delicious. The best sources include leafy greens like spinach, kale, and romaine lettuce. You will also find folate in beans, lentils, and citrus fruits like oranges. This table displays the folate content per serving for various food sources. Clearly, lentils are the richest source, providing nearly 90% of daily folate need in 1 cup. Chickpeas and avocado are also excellent sources, covering about 70% and 20% of daily folate needs, respectively. These foods are not only rich in folate, but also packed with other nutrients that support overall health. If you are not already incorporating these into your diet, now is the perfect time to start. Now, let's look at the top choices of folate supplement and how to get the most out of them. 5-methyl-tetrahydrofolate, or 5-MTHF for short, is a standout, offering high bioavailability and easy absorption. A great option like pure encapsulation folate is gentle on digestion while providing maximum benefits without gastrointestinal distress. Then we have folic acid, the synthetic form, but it's important to know that your body has to convert folic acid into active folate, a process that can be inefficient for some. This is why 5-methyl-tetrahydrofolate is often the preferred choice for diabetics. Here is a pro tip. Take folate in the morning with food for optimal absorption. And if you are combining it with vitamin B12, go for methylcobalamin, the active form, to unlock even more powerful benefits. Be aware that potential interactions do exist with metformin users,
as metformin may reduce folate levels, so supplementation is beneficial. If you have kidney disease, high doses of folate should be taken under medical supervision. Also, folate supplementation can mask B12 deficiency, so ensure adequate intake of both. As we've just revealed, vitamin B9 or folate could be a game changer for diabetics, helping to lower blood sugar, reduce inflammation, improve wound healing, and protect against cardiovascular disease. If you suspect you have a folate deficiency, it's crucial to consult your healthcare provider for personalized treatment and dosing recommendations. Now, we want to hear from you. What are some lifestyle changes you've made to manage your diabetes? Have you tried any specific diets or supplements to improve your glucose levels? Share your experiences in the comments below. And if you found this video helpful, don't forget to like, comment, and subscribe. By subscribing, you will stay up to date with the latest insights and tips to help you take control of your health. Remember, your health is your most valuable asset. Make sure you are giving your body the best chance to thrive. Thanks for watching, and we will see you in the next video.